Okay, so what brings you in today?
My foot really hurts.
Okay, can you just tell me a little bit about it? Like, what happened?
I'm not really sure. It just kind of came out of nowhere. But like the bottom of my foot just started hurting and it's gotten worse.
Okay, what foot is it?
It's my right foot.
Right foot? Okay. What kind of sport do you play?
I play soccer.
Soccer? Okay. How old are you?
I'm 20.
20. Okay. Have you had any other previous injuries to your feet or ankles or anything like that?
No.
No? Okay. Can you point to like the exact place of your pain for me?
It kind of hurts in here.
In there?
Yeah.
Okay. Describe your pain to me. Like, what kind of pain is it?
It hurts really bad when I step down on my heel.
On your heel? So when you heel strike?
Mm-hmm.
Okay. Have you done anything to alleviate your pain or anything like that?
No.
Okay. What makes your pain better?
Rest.
Rest. Okay. What makes it worse?
Running.
Running?
And when especially I'm in practice, it hurts a lot.
Okay. Have you had any like changes in your training pattern recently that have like increased in intensity or anything like that?
Yeah, I started doing more like hill runs and more like long distance runs.
Okay. Let's see. Has that changed since this pain has started?
Yes.
Yeah.
It started happening when I changed my workout plan.
Is the pain isolated to the point that you pointed out to me, or does it radiate? Does it move around?
It kind of radiates,
Okay.
but it's mostly that spot where I pointed out.
Okay. Perfect. Have you noticed any numbness, tingling, or anything like that in your foot, lower leg?
No.
Okay. And as you said, there's just only point tenderness right there?
Yeah.
Okay. So as of right now, I'm thinking we are either dealing with a heel spur, Achilles tendonitis, kind of. We'll see, we'll assess that. And then probably maybe plantar fasciitis as well, okay?
Okay.
So we're gonna move on to inspection. We'll compare bilaterally. So we'll have both of her feet available. When I look at the bottom of your feet, am I noticing any swelling or anything, any discoloration?
There is slight swelling, but no discoloration.
Okay. Is there any calluses that I can see from wear and tear of shoes or anything like that?
No.
Okay. Let's see. I'm gonna have you stand up and I'll have you just walk in a straight line towards me so we can see any gait abnormalities. Okay, turn around, let's go back to the table. Okay, if you wanna just hop back up there and let's see. Do you have normal foot? Is it supinated, pronated?
I have pes planus.
Planus. Okay. Let's see. Have you noticed any changes in wear patterns in your shoes?
No.
No? Okay. And alrighty. So we're gonna move into palpation. I'm just gonna start here on this medial side. Make sure there's nothing that's up here, further up. So I'm gonna palpate this medial malleolus. Anything down here on the deltoid ligament, we're good. Okay. How's the navicular? Good, good. Okay, I'm gonna come down here. This hurts. Okay. Here's all the way down here to the
Back there is fine.
back here is fine.
Yeah.
How's just straight on the bottom?
It's okay.
Okay. And the pain starts right about here?
Yeah.
Okay. Is there any pain that comes up through here?
Mm-mm.
No? Okay. I'm gonna palpate the back side. Let's relax your foot. I'm gonna palpate your Achilles. Any pain there?
No.
Okay. Once again, we're just gonna do the side. We'll do the lateral malleolus just to see.
No.
Anything on your ligaments? Okay. But no pain on the base of the fifth? And we're just gonna do that same thing on the calcaneus for that attachment point of the plantar fascia. Is the pain both sides or is it just medial?
It's just more medial.
Medial? Okay. Let's do the same thing over here and make sure that I didn't feel any abnormalities. Alrighty. So I'm gonna have you just do some range of motion for me.
Okay.
We will do it both feet at the same time, just so we can see if there's any changes. So I'm gonna have you bring your toes up to your shins in dorsiflexion. Okay, relax. We'll have you point your toes as much as you can down into plantar flexion. Good. And now we'll have you rotate your foot outwards into eversion. Good. We'll come into inversion as well, rotating in. Good. Okay, can I also have you scrunch your toes? Good. Can I have you extend your toes? Okay. Was there any pain or discomfort with any of those?
With dorsiflexion on this one and toe extension.
Toe extension.
It hurt really bad.
Okay. And it's just at your point of pain or did it radiate?
It kind of radiated.
Okay.
But, I mean, like, just still right there.
Okay. Did it go into your foot or up into the back of your leg?
Up into the foot.
Okay. So I'm just gonna do those movements for you. We'll start over here on your uninjured. And so we'll come up into dorsy, just so I can feel how it normally feels with you. Good. We'll do some inversion. I'm gonna move your toes for you. Okay. Alrighty, we'll do the same right here. If you can just relax. I'll do my best not to push on that point. Plantar flexion. This one hurts?
Yeah.
Okay. We're gonna invert. Okay, I'm gonna move your toes for you. Scrunch. That one hurts?
Yeah.
Okay. I'm just gonna do a little bit of joint play just to make sure that there's nothing else going on up in here. So we're just gonna do some intermetatarsal joint play. So, that okay? That okay? All good? Okay, let's do a little squeeze test.
Yeah.
Any pain?
No.
Okay, let's do the same over here. Make sure it's all the same. Good. 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 Squeeze test. Good. Okay, so based on evaluation and my findings, I'm gonna say you have a heel spur.